Hello and welcome to Renaxis and Supreme Rejuvenation's first podcast. We're going to be talking to the world-renowned Dr. Robert Talick, who studied at Mayo Clinic. He's also one of the best orthopedic surgeons out there. He has a lot of accolades. Lots of professional athletes go to him. Dr. Talick, welcome to the broadcast and thank you for being here. And would you tell us a little bit about your background and some of your accolades?
Thank you, Jonathan. So I am orthopedic spine surgeon. I am 100% focusing on regenerative orthopedic and spine care. I have been in medical field now almost unbelievably 30 decades. I have started my professional career in Czech Republic in Masaryk Memorial Cancer Institute in Brno, where I initially studied and focused on cancer treatment. This is also where I start my professional interest in immune-based therapies, mostly for trying to harness immune system to treat cancer. I have spent significant amount of time in multiple renowned institutions in Europe, Oxford University, University of Louis Pasteur in Strasbourg, France. I have also in 1999, I have visited Mayo Clinic, Rochester, Minnesota, where I spent 4 years in the Department of Orthopedic and Tissue Engineering, studying new ways to harness the healing of tissues, and studied at that time a biodegradable polymers. I have also worked at the University of California, San Diego, and finally in Center for Spine Health in Cleveland Clinic, Ohio. I have been author more than 50 professional research articles and have been privileged to participate in several orthopedic and spine textbooks. But I think, Jonathan, right now, after more than 3 decades in this field, I think the most important part is that I do know what works and what doesn't. And that's what I'd like to share some of my thoughts here. So thank you very much for having me.
You're welcome. And he's also a published author, guys. Look up Dr. Robert Talick's books out there. I'll tell you, I'm really excited about this space, doctor, and I'd love to know more about what is regenerative medicine as a whole.
Well, this is a very important question, Jonathan. The regenerative medicine is fundamental different approach to treating or healing orthopedic or spine problems. Traditional orthopedic is mostly focused on managing pain or symptoms. And of course, we try to then, as a secondary result, to focus on spine. In contrast, regenerative medicine is the therapy that seek to repair or rejuvenation of tissues by harnessing innate ability to heal. We are trying to activate and also prime the innate cells, they've been called previously stem cell, and to promote healing in a more natural way. So this is fundamentally different because in regenerative space, the doctor has to look more holistically in the patient, because we are in most cases, we are dealing with immune-based system, and we are trying to manipulate the system to promote healing.
And so, doctor, can you tell me, is this stem cells, or because there's a lot of talk about stem cells everywhere and stem cell therapy? Is that what we're talking here?
Not really. This is a little bit more complex. So let me a little bit unpack this, Jonathan. Traditionally, these regenerative therapies are basically based on transplantation of cells that has been harvested either from bone marrow or from fat tissue, and then we try to expand those cells in vitro, meaning in petri dish, and then transplanting or transferring those cells into a disease or injured tissue. This approach has numerous disadvantages. Number one, there is necessity for harvesting procedure. It is surgical procedure, whether it is bone marrow aspiration or liposuction. This procedure has their own set of challenges, potential complication. The second part is a harvesting and preparing a sufficient amount of what I call suitable cells. And this is a major challenge because we know that right now from biology that this, what they call mesenchymal stem cells, do not actually exist. This hypothesis has been debunked, and we now know that those cells that are responsible for healing are in every tissue. They are actually part of the vasculature and in every tissue. So once we were trying to harvest those cells and prepare them in vitro, there are significant changes. Number one, we know that not all those cells survive, and with every passage through the cell culture, we select only subpopulation of these cells. What remains right now is really a challenge where I'm just looking for the word, where we do not know if that process which we put those cells through and the changes that we induce in those cells, really, how does it affect performance of those cells? There are increasing amount of researchers or people like myself who believes that just indiscriminate use of so-called mesenchymal stem cells, or they call it now MSCs, which is actually stands for medicinal signaling cells, into different tissues or different treatment strategies are suboptimal, because those are not cells that have been initially harvested, but those are that may be significantly different population. So that strategy is significantly more complex than one can see. There is another issue that every treatment strategy using this philosophy has to comply with pretty stringent FDA regulations. And in my opinion, given the current landscape in FDA, I think that it is slim, the chances that those strategies will make clinical utility are slim to none. They are more important because we are learning about biology. In fact, there is a new field or direction in this area, and it's called fancy expression is in situ regeneration. This strategy uses a local resident cells. We do not harvest any cells from any bone marrow, fat, or any other tissue. We actually prime the local pericytes. These are cells responsible for governing the tissue repair. And this in situ regeneration is more straightforward. It's not as intensive from regulatory environment. So no, these are no stem cell therapies. In fact, Dr. Arnold Kaplan, who is one of considered father of this field and who coined the term mesenchymal stem cell, has received his lifetime achievement award last year. And the topic of his keynote was, "There are no adult stem cells. Can you hear me now?" So despite the fact that this claim that there are stem cells which will differentiate into muscle, cartilage, and others, and this is the key claim of many so-called stem cell clinic, I hate to disappoint you and others that there are no stem cells. In fact, what we know now, that tissue regeneration and healing is done through expression and activation of these nanoparticles. These are called MSC exosomes that are carriers of multiple different signaling molecules, and those molecules actually prime and regulate entire healing.
So you're basically saying, so the products that you're using, mesenchymal exosomes, They have no stem cells, doctor. Am I correct?
Correct. So these are, okay, let me little bit elaborate what those MSC exosomes are. These exosomes are small subcellular vesicles that are nanometer size. They contain a multiple proteins, RNAs, and different factors. These vesicles are key for cell-to-cell communication. They are basically a communication system between cells. And what we now understand about healing of the disease or injured tissue is that when there is an injury, mostly that injury will lead to disruption of blood supply. Mostly there is a small or bigger bleeding. So the first step is the blood clot. The platelets and fibrin will stop the bleeding and fill the space of injured tissue. Subsequently, these platelets will release growth factors. They will activate, we call them pericytes. These are these resident MSC-like cells. They will detach from the basement membrane of capillaries, and they will release the cargo of exosomes, these small particles. They basically pinch off these little vesicles with RNA, with proteins and different factors. They will now prime this local environment. What we know that those exosomes will have three major functions. Number one, it will affect cell-to-cell communication. These recipient cells will receive and absorb these proteins. You can think of it a little bit like a vaccine for COVID. So there is a mRNA and others. So those cells will start producing different factors. The second part, some of those growth factors will directly affect those target cells that will make them to divide and create new cells. They will also affect creation of new blood supply through a process it's called angiogenesis. And there is also some evidence that some of those exosomes contain organelles. It's called mitochondria. The mitochondria are our production of our energy. That's what makes ATP, or our energy substrate. And we have some studies, they show that some of those mesenchymal cells or pericytes, I hate to confuse people, those pericytes or resident progenitor cells will release mitochondria, which will in recipient cells help them to survive because they will get more energy. There are some effects on what they call programmed cell death. So there are myriads of effects how this goes. We don't have full understanding of it, but what we know almost for sure, that those cells will not repopulate the tissue and change it to fat or muscle or cartilage. Does that make some sense?
Yes, it does, doctor. So my understanding is these exosomes can help various diseases. I've heard up to 150 different diseases. Is this because the inflammation, most diseases are caused by inflammation, correct me if I'm wrong, but how can it help with diseases like Parkinson's? And I'm trying to understand the exosomes more, so I'd like to know, how do they work, Doc?
Well, we have
told me a little bit, but
okay. So Jonathan, as I was telling you, that we are now understanding and studying really intensively what different functions those exosomes have. It is important that we also will figure out, and when somebody will try to look at internet, mostly, there are also exosomes that are shed by tumor cells. And we use those for diagnostic purposes to know and treat the cancer. I am not talking about these type of exosomes. I'm talking about exosomes that are now shed by, let's call them for now for the sake of our conversation, MSCs, meaning medicinal signaling cells, or MSCs derived exosomes. What do we know currently? That these MSC derived exosomes have shown a various effects on cells. So let's say I am surgeon, wound healing. We have seen that application of exosomes will promote reepithelialization, meaning faster healing of the skin. They have prevented a cell death and of course on the skin mostly. They, in cardiovascular system, we have seen that application of exosomes will reduce infarct size. It will enhance repair through stimulation of revascularization or creation of new blood supply in the tissue. I am not talking, I just want to make sure these are studies, experimental studies. There are some of them on animals, some of them are on clinical studies on humans, but this is still in a phase of clinical research. I am not talking about that this is a mainstream treatment. We also have neurodegenerative diseases such as multiple sclerosis, Alzheimer, and others, because we now understand more about biology behind those diseases, and it seems that there are fair amount of autoimmune or chronic inflammation. And because one of the effect of exosomes is modulation of immune system by priming, in other words, these cells, pericytes, once they shed those exosomes, they prime the response. In other words, they will affect the response of the targeted tissue to different stimulus. In lay language, if you have a injury and your MSC cells will not send the stimulus, your immune system will start fighting the damaged tissue, and you have a chronic inflammation, disease, and damage to the targeted area. This, for example, this is very new finding with osteoarthritis in the knee, where we all were focusing on cartilage, when we now know that this is a problem of entire joint, and actually modification of a environment inside of the knee is much more important than focusing on fixing the crack in a cartilage. These are multiple areas. So from wound healing, cardiovascular, there are studies for kidney. I have seen studies, they are helping with liver problems, of course, neurodegenerative problems, and most importantly, there is a absolute explosion of cosmetics, because we know that those exosomes help with the skin.
Right.
One of the reasons that is explosion in cosmetics, because FDA does not regulate cosmetic products.
Right. Which brings me to my next question, doctor. These exosomes, tell us about the FDA and the regulations, and how do you choose what exosome to use? Because I know that's really important, and it's a hot topic everywhere. There's situations happening where people are using cosmetic exosomes internally. Could you elaborate a little bit about on the legalities and how the FDA is and how doctors are able to use the right product?
Well, John, this is a bit complex but incredibly important question. Let me dissect a little bit so we don't get flooded with this, because this is topic on its own. So number one, I would like to explain that FDA in their name is Food, Food and Drug Administration, does not regulate food and cosmetic products. They are solely responsible for protecting public health and ensuring the safety of drugs, biological products, and medical devices. That's number one. Now, before any product, and this definition applies to exosomes or other biologics, PRP, PRF, bone marrow aspirate, fat aspiration product, stromal vascular fragments, you name it. All these products will fall under the umbrella of FDA under biologics. Now, before any of those products can be used in general treatment, they have to go through the pretty rigorous regulatory scrutiny. Let me just make a really brief description what does it mean. So the first, the manufacturer has to produce preclinical data. These are data that the product is safe and effective. We call it a preclinical phase. Once those data are gathered, and manufacturer will be able to submit a so-called application for IND. It is called investigational new drug application. So the FDA, once they will receive IND application, will review it and will grant IND approval. That is very important because once the drug or product has IND certificate, it can enter the clinical research. What does it mean? That medicine will be now tested in phase 1, 2, and 3 clinical studies. And these studies are conducted with ever increasing number of patients. And again, we are looking at safety, efficacy, side effects, and numerous different things for particular indication. Once this is done, then all the data are gathered and manufacturer has to submit it to FDA, which FDA will review it and may or may not issue so-called BLA, Biologic License Application. If you receive it as a manufacturer, congratulations, you can sell the drugs to everybody. Now, what the people will need to understand, in average, this process costs between $35 to $100 million. So this is kind of in a nutshell what the every medicine needs to go. So when I, in my clinic, use the biologics, I am looking at those companies, they go through the process. There is a ton of manufacturer who will claim they have exosomes, but they tell people use it for cosmetics because that's not regulated it's not regulated by FDA. I would use the analogy, I hope that this will not get us in trouble, like when people were talking about ivermectin and taking it from the tractor or supply, which was intended for veterinary purposes. Those are not same, they may have a similar name, but these are not same products. Right. So I know of only right now two companies, they have received IND. One of them is obviously the company we work together, and they from LSU. And there is another, I believe that recently there was a Chimera Lab also received for one of their product from Florida. So it is very important that whoever using the medicine understand how the process applies, what is the right path, and also see through some of the marketing parts, because it is very important to use the safe strategies. For example, in my clinic, we have clinical trials. We perform clinical studies. So yes, the patients are enrolled and they can receive those exosome treatments if they become the candidates or eligible for the treatment. I also use, if I may, I use PRF, which is a second generation of blood product. That particular biomatrix, it's not directly regulated by FDA, but it is regulated through use of tubes, believe or not, under a so-called 510K clearance pathway. So because we use tubes for other blood product, that clearance is done because those tubes are substantially equivalent as the others. So I hope that this will help to clarify somewhat this landscape, but it is quite confusing even for a regular doctor who does not do these clinical research and doesn't go through the processes. So many of them will mix clearance with approval and biologics with non-biologics and cosmetic application or nutritional food supplements with the drugs.
Yeah,
Devil is in details, like with everything.
I've heard that, doctor. I've heard exosomes coming from animals and plants, and doctors are using them and internally, which I know cannot be good if you're injecting plant exosomes. But doctor, one of the things I wanted to mention is so our exosomes. Obviously, we've been through the 3 clinical trials. It was our product has been 10 years in research, and we received a 351A master file by the FDA. And we're the only company in the U.S., even though the other company you mentioned, they're just still in the first stage of their clinical trial on their product, where we've already surpassed 10 years and have officially master filed for the 351A, which was accepted by the FDA as a 351A. So we're able to, which is why you use our product. I remember when we first walked into your office, you said, "You have a 351A. This is music to my ears." So I remember that, doctor, and I appreciate that. And I think this has been a great discussion, doctor. We've been on for about 30 minutes, and I don't want to go too much longer, but let's keep doing this, doctor. Well, this is going to be the first series of several. A lot of people have a lot of questions, and they want their questions answered. More so physicians and clinics, and people are using exosomes. Exosomes is a buzzword everywhere right now. And it's an exciting time to be in this space. And I'm looking forward to learning more from you, doctor.
Well, I would be happy to. I think that best contra argument for misinformation is to provide correct information. And I would be happy to participate in these podcasts or providing some information for more general public, because it is again, some of those things that I hear are bluntly not true. And like what I like to use, and I have presented this several times, my presentation about stem cells, it's called A Myth of Stem Cells. I will be happy to maybe if we can organize some of the more focused these podcasts, let's say look at arthritis, knee and hips in orthopedics, or we can talk about spine care or neck care. We can have other stuff. So
absolutely.
And I think that we are seeing some of the questions. If we have, let's say, 5 minutes or so, I would be. There is the question that is I believe. Question is, how does one qualify to get exosomes? So of course the question somewhat is misleading, Mr. Marciano, because first you have to have a disease or the condition that we use this to treat with. We are not starting with who qualifies for antibiotics, who qualify for some condition that we treat with antibiotics. So let's say we have almost all what I would say the common orthopedic diagnosis, like knee arthritis, some of the hip arthritis, back and neck, we have problems with the discs, we have some neurodegenerative, we have protocols for neurodegenerative problems like multiple sclerosis, Alzheimer, and stuff. So the first step is that you will express an interest. We see in our clinic, I see the patients, we evaluate the patient, and then we offer these regenerative strategies. In general, maybe to patients that are interested in this, we look at, or I look at it from a relatively simple perspective. When we applying regenerative strategy, we always have to look at three parameters. First is the patient. We are not treating a knee or hip. We always treating entire patient because we are manipulating their entire immune system. If the patient is diabetic, malnourished, or has a celiac because he or she does not absorb nutrition, that needs to be corrected before we can apply any of those treatments. Second, you still have to be, in my opinion, a doctor or professional who diagnose what is the problem. These cells do not work that you inject them systematically. They find a way, they figure out what's going on, they treat and heal everything, and you just come out new, healthy, and 10 years younger. This is not how it works. That's a hype. The physician needs to fully understand what is treated, why it works, and what is the underlying biologic process that we are trying to manipulate by activating and priming that local environment. The third is the treatment itself. You have to make sure that we will modify or minimize the collateral trauma. And that all these three parameters, meaning patient, disease, and treatment, will equal or result in outcome. And hopefully, when you as a patient participate in these type of therapies, will ask your provider or doctor if he or she is actually looking at three parameters. I think that one of the warning sign of these things, when you come to clinic and doctor or provider says, oh, it's just a shot, that means that you are not in regenerative therapy clinic. You are just in a marketing clinic. They use the hype around to use the analogy or perceived benefit, but it very likely it will not work. You need to have a conversation with your doctor. They need to diagnose the problem. They need to explain and understand the biology, and that apply it.
Good answer, doctor. Yeah, that's why it's under research and investigational use, because you really need to understand what you're doing and studying the patient, because it's like people get treated, doctor, at different clinics, and sometimes their expectations are really high, but they may have several ailments, or they may have a few drinks after they take the product, and the aftercare and your health and diet is so important to everything we do. And people have to take that into consideration.
Well, Jonathan, I will tell you, I have one of my major, or I think number one reason why these therapies will fail is what I call pain management after harvesting procedure. What I mean by that is this. Let's say you are coming to clinic for so-called stem cell therapy for your knee arthritis. They will recommend that you get a bone marrow aspiration, which is a surgical procedure, which is not very pleasant. It is painful.
Right.
And there's nothing wrong with that. We do surgery and we have the medicine to deal with it. But in a context of regenerative therapy, this is what very likely happen. They will make in local anesthesia or under sedation. The clinic will make a small incision. They will aspirate your bone marrow. They will process and inject your knee. The procedure itself in your knee, it's not very bothersome or any painful. But what do we know from biology? First 5 days, those cells will initiate a inflammatory reaction. So your knee and your donor side will be sore. What very often happens, that patient is not really engaged in the what's going on and will take Aleve, anti-inflammatory for pain. In United States, everybody for any other problem pop Aleve or two. What that means, that treatment was just shut down. The result will be for sure suboptimal or zero. I see this very often. The second part is that they receive this so-called injection, whether it's a bone marrow, you name it, it doesn't matter. They do not understand that injection is only a initiation of innate regenerative strategy. You have to provide some building blocks, mostly if you deal soft tissues like collagen, some vitamins, you have to have some minerals, because all those materials are necessary to build a new tissue you are trying to stimulate or manipulate. I tell my patients there is no point to call construction workers if you are not going to give them material. And third, all those tissues, especially in musculoskeletal world, respond to movement or load. So if you don't engage in proper rehab, the outcome will not be good. So probably 9 times out of 10 of these patients, they come to our clinic and they said, oh, I have this treatment, it didn't work. I ask 1 or 3 questions. Number one, did you take any Aleve right after? Many times, yes. What kind of support did you have for the treatment after? They said, no, we got shot. And third, no exercises, no rehab, no nothing. This is a fundamentally misunderstanding a treatment. This is what I call the application of traditional medicine, meaning give the steroid shot and forget about it, just using different medicine. Again, I am telling you those cells or those tools are just tools. If you don't know what you're doing, it's not gonna help.
Right. Well, doctor, that's a really nice first podcast we just had. And I understand that this is the future of medicine. It's the future of treating people. And I'm very excited to be learning from you and talking about exosomes. And, you guys out there, make sure you look up Dr. Talek. Dr. Talek, you have athletes flying in from all over the world, soccer champions, tennis champions, PGA champions. I mean, you have a wall of accolades of all these athletes that the world looks up to. So, Dr. Talek, it's nice to have you, and knowing what you're talking about is really important. And I hope other people can.
Jonathan, thank you very much. I'm more than happy. Yes, I've been privileged to take care of some of the prominent things, and I think that I thinking about it, I am more than happy to share this know-how, if you will, or knowledge that has been maybe previously accessible only to professional athletes or maybe celebrities. I'm more than happy to provide this information with no strings. I have been in this area for more than, now it's 30 years. Oh my God. Yes, I truly believe that this regenerative medicine will be a game changer. Just from my own perspective, I am fully trained orthopedic spine surgeon. I have done 2 fellowships and done extensive training. It had one of the biggest effect on my practice was a significant decrease of surgical intervention. In my experience, 7 out of 10 patients, they are kind of looking down the barrel to have a surgical intervention, still can avoid it at the minimum.
That was me when I met you, doctor. Remember, I was thinking about having surgery, and the exosomes fixed my knee. I was just really in shock over it. But you're right, doctor. It's just completely the spectrum has changed, you know, from old traditional methods to what can work now and today. You know, it's an amazing time we're in.
Yep. I think we will do these more. Okay.
Okay. I'm looking forward to it, Doctor. Thanks everyone for watching. We're gonna do this every other week or something like that. We may even do it more often than not. So thanks everyone. Thank you.
I will be happy to. Thank you very much. You have a great day.
See you next time, Doctor.
Take care.
Thank you. You too.